Hello everyone, welcome back. We're still working with Chase, this big boy. He did a couple of points on his hip flexors and quads, and I decided that it worth it to film and show you a few tricks. All right, guys. Many of you, when you work out, you use your hip flexors, psoas and psoas, right here, the inside of your trunk, inside of your core, a lot. However, it's a muscle which really hard to touch or even visually see it. But every motion when you raise your legs, you use this muscle. So, and a lot of athletes, this type of feelings extremely uncomfortable. We worked with Chase a little bit before, so they fairly loosen up right now, but I want to show you that to touch your hip flexors, you need to dig in a little bit right here. You feel it, right? So how you would describe your feelings right now?
Like you're
Ticklish?
no, like you're actually like going down on the muscle.
Yeah?
I feel it.
Is it discomfort? Is it pain?
A little slight discomfort. It's not
Slightly discomfort. Not really a common feeling, right? Or like somebody would do something like this, right?
Yeah.
In my practice, when people complain for the lower back pain, tension, limitation in the lower back, mobility, 50% cases, it's an issue with the hip flexors. They became too tight. Those of you who sit a lot, guarantee have a shortness of the hip flexors, and it'll create limitation in your lower back. So yes, massage, it's a great way to stretch and lose your hip flexors, but you also can gently elongate them via stretching. You can warm up your muscles in a hot bath, in a sauna, in a steam room, and try to stretch. Or you can call me. So this is about 50% how far you can go, dip in a hip flexor. However, for the first time, or for someone who's not really frequently practice this type of massage, I would recommend do not go over this level because then discomfort would, go above of comfort.
Oh.
Sometime when people have a full bladder, you may feel urge, run to the bathroom. That's totally fine. Take a second of break, go to the bathroom, come back. Because sometimes people not realize, but I'm kind of a creative pressure on obliques and your abs, and on a lower abdominal, that's where you have your nerve bladder, and it may create a little bit of discomfort. People not fully realize that, but if I say, hey, maybe you should jump and run to the bathroom for a second, it kind of help. This side feels a little tighter, right?
Yeah.
All right. It's totally normal. Usually left and right feel different. So in case one of the side are tighter, what you can, you grab his leg, you lift the thigh up, right? So what do, you flex a little bit of the hip flexor. Try to find a right angle, guys, so you can see it. You can lift a little higher. I stay steady. I'm not pushing deeper. I just play with his hip. It's intense, right?
Yes. Oof.
So my pressure on his hip flexors remain in the same level. Only what happens, I play with his leg. And now when the leg go down, good. You definitely feel the difference, right?
Yeah, definitely. It's way more intense.
It's more intense on your left side, right?
Yeah, you lift it like.
Most runners have a lot of tension on the hip flexors. I definitely try to film as much as possible different, body types, shapes, condition, muscle, size and definition, because on different bodies, the hip flexors, they act differently, depend how tall, depend how heavy, depend how powerful the core. Runners, powerlifters, bodybuilders, wrestlers, people have different usage. Those people who sit a lot, office workers often have really, really bad condition of the hip flexors. People who drives a lot, like me, if you spend 2-3 hours in a day in a car, you're in a sitting position, and when your hips is flex, like right here, your hip flexors stretch. It's actually just in a neutral position, but this, what a lot of people remain the hip flexors, and that's almost 75% of entire hip flexion. This is a full flexion. Right? You feel it. I would definitely recommend to practice this at least once a week. You even can do this by yourself, or you can ask someone who you trust. Go gently. Dive into the side. So if that's a hip, you just go slightly off the groove right here. Take your time. Feel the breathing. You see, the right side of the chase hip flexors so much easier. It's almost like nothing compared to the left, which totally fine. All right, here I should also mention that quads play a big role. So a lot of time, tight quads may lead to extra tension to your hip flexors. So here I would suggest always add a little bit of the work for your quads. It doesn't have to be anything extra heavy or extra brutal. Always, always do both sides. Even someone may complain only for one side, you always do two sides. You may spend more time, almost double up on a side which require more work, but keep in mind you must spend some time and attention on other side, even though it may not hurt at all. The basic explanation of that, it's a supercompensation effect or overcompensation when you, one side which in pain or hurt, you overcompensate with a healthy side or side which has no limitation, and while one side which injured or in pain healing, you abusing your healthy side. And by the time when the pain part gone, you start having discomfort or pain or tension or all the above in the healthy side. So when you stretch, when you massage yourself, when you try to take care of yourself, it's always both sides. Try to keep it simple without any, crazy techniques, super points, something which all of you can do at home for your partner, for your friend, for your husband, or just a good buddy who you want to help. Could you do it by yourself? I guess you could. It would be not as easy, but I believe if you have a good buddy who willing to help you a bit, that's a simple way to help it. It's a 10-15 minutes. If you have any questions, feel free to leave me a comment. I try reply for all my comments, and don't forget to subscribe and follow. Click the button and give me your suggestion what I should massage next. Thank you guys. Ciao.